If there's 10 people in a room right now, 7.5 or roughly 8 people, because it can't be a half person, 8 people are going to be overweight or obese. Okay, just think about that. If there's 100 people in the room, 75 people are going to be overweight or obese. Okay, that's America today. That is the first time in history that's ever been, a fact. So you got to understand something's changed, something's different. And what's most important to understand about obesity is this. Obesity increases cholesterol in the body. Okay, so it's going to increase fat in the body. That's obvious. It's also going to increase your blood pressure. Okay, it's also going to increase your risk for diabetes. Now you're metabolically unhealthy. And it's also going to put a lot of pressure on the heart, because typically when people are obese, a lot of that fat is going to be concentrated in the torso area. So it's going to put a lot of pressure on the internal organs, but also a lot of pressure on the heart, because now this fat is going to be throughout the tissue in the heart and all around the other organs as well too. So obesity is a major contributor. As a matter of fact, obesity is probably tied with high blood pressure, which is a silent killer, as 1 and 2 risk factors for heart disease or a heart attack. Okay, so of course it makes sense if they're the primary causes, then it makes sense that they're the primary solutions too, to lower the blood pressure and to get to a normal or healthy blood body weight. Okay, so hugely important. Other causes are going to be deficiencies. Okay, now what you'll notice is, for those of you out there who either have an uncle or aunt, or maybe you have been put on prescription medications for things like high blood pressure, coronary artery disease, etc. What you'll notice is that many of the things are correcting issues with deficiencies. I'll give you an example. A lot of people will take a drug called Norvasc. Norvasc is a calcium channel blocker. So it's sort of manipulating the calcium in the body. Okay, a lot of people will also have issues with potassium. Potassium is very key when it comes to heart health, okay, and blood pressure. Also, another key element is going to be magnesium as well. And a key nutrient will be quercetin. Okay, quercetin it can be found in food. Okay, so you can find quercetin in food. And the cool thing about quercetin is when you eat the right foods, quercetin, a natural nutrient found in foods, can inhibit oxidation. Okay, what's the issue with oxidation? Okay, you remember when I was saying earlier how cholesterol is simply a builder and repairer? Okay, it just goes in and builds and repair. Okay, when there's inflammation, when there's insult. Okay, a lot of the insult is occurring once the cholesterol comes in to build and repair and patch up the spot, like putting on a Band-Aid. Oxidation comes in and makes that cholesterol hard. Okay, so that's why they call it, plaque in the artery. It gets hard. Okay, it's oxidation that's causing that. Okay, so if you eat foods that have the right nutrients in them, like quercetin, the really cool thing is that they're antioxidants. Okay, so they're going to prevent the oxidation, which means it's going to prevent the hardening of the arteries. So when the arteries get hard and stiff, they're hard to move blood through. Okay, if something is stiff and hard versus very elastic, the stiffness is going to cause an increase in pressure. Okay, the best example I can give you is I can give you a pipe that's made of like PVC pipe that's thick plastic. Now that is very hard. So the pressure is going to be hard inside of there. But if I give you a balloon and put water in it, it's very flexible. Okay, so the pressure isn't going to be as high in there. Okay, and that's what happens. Okay, when you're getting this plaque in there as a result of oxidation. Okay, hugely important. So you want to correct deficiencies. The other thing is toxicity. Okay, there are a lot of cardiotoxins, things that are toxic to the heart tissue. Okay, and these cardiotoxins will cause arrhythmias. Okay, so if you might have an arrhythmia, you can have a murmur, things of that nature. Chemo drugs, radiation are actually cardiotoxic. Okay, I'll give you an example of a drug called doxorubicin. Doxorubicin is used for breast cancer. Okay, doxorubicin is a cardiotoxin, okay? Radiation is a cardiotoxin, so it can affect the heart. As a matter of fact, a large majority of patients who die of cancer, a large majority of them who use chemo, a large majority of them actually die of a heart attack, okay? They don't actually die of the cancer, okay? So it's really important. Erectile dysfunction drugs. So drugs like Viagra, Cialis, these drugs are actually cardiotoxic. As a matter of fact, Viagra, when it first came out, it came out as to be used for the heart, okay? And they noticed one of the side effects of using the drug was that it gave you an erection, okay? So that's how Viagra came to be. But it's important to know that these drugs are actually cardiotoxic. They're toxic to the heart tissue, okay? Mercury. So if you consume a lot of fish, and fish will have a lot of mercury in it because the fish, especially from the seas, will consume that mercury as a result of being in the sea. So a lot of people will have mercury toxicity, never know about it, and it can cause arrhythmias. It can cause issues with the heart as well. And also things like energy drinks, stimulants like, ADHD medications, and so forth and so on. So those are just a few things that cause issues of the heart. And what I want to do now is sort of dive into some of the foods, some of the herbs, and some of the holistic approaches you should take if you want to, prevent your arteries from getting clogged and also prevent a heart attack, okay? But before I do that, what I want to do, again, is remind you is that these are things that could work as a form of prevention, and prevention is far better than a cure, okay? So if you don't have any issues with heart disease, is, as they always say, an ounce of prevention is worth a pound of cures, okay? So focus on prevention if you don't have any issues now. And if you have issues, you can still use these, but here's the most important thing. You have to start with a lifestyle shift. If you don't start with a lifestyle shift first, the issue that you're gonna have is none of these things will work. I can give you foods, I can give you herbs, I can give you holistic things that you can do, but the unfortunate thing is this, those things don't work unless you do. You gotta change your lifestyle. And if people get on the internet and start telling people, oh, if you eat this and you eat that, it'll help with your heart disease without changing your lifestyle, the thing that actually caused it, it will not help you, okay? So you gotta do these things first. First things first, shift your diet to a cleansing diet that's not clogging, okay? Because again, you're clogging up your arteries, so you means that you're eating foods that clog. So switch to foods that cleanse. Those are fruits, vegetables, nuts, and seeds. Okay, hugely important. The second thing is exercise. You have to exercise. You got to get moving because we live in a society that is very sedentary. And the cool thing about exercise is it's not only going to improve your blood flow, but it's also going to improve the flow of your lymphatic system too, which holds about 80% of the fluid volume in your body, okay, which could affect the heart, okay? The other thing that's really important is managing stress. Stress does have an impact on our heart. Just think about it. If I were to scare the bejesus out of you right now, your heart rate would increase, okay? And that's what happens every time you get stressed, okay? So you gotta manage your stress. We can't live in a stress-free world, but we can live in a world where we properly manage our stress. The other thing is adequate sleep. Sleep is when you heal at night, okay? That's when you heal. So if you're not getting adequate sleep, sound quality sleep, then you don't have the time to repair, the time to heal, the time to restore. The other thing is corrective deficiencies. So if you got vitamin D deficiencies, which impacts the heart, if you got omega-3 deficiencies, which will definitely impact the heart because omega-3s are anti-inflammatory. And I told you how inflammation is a critical part of actually developing heart disease. Correcting deficiencies is going to be very important. Okay, and then detoxing and cleansing to get all of that toxicity out of the body. Okay, so let's dive into a few foods and then we're gonna wrap up today. Pomegranate. Pomegranate because it's rich in polyphenols and also very rich in anthocyanins, okay? Polyphenols can be found in cloves, also can be found in cacao, and it also can be found in grapes, okay? Rich in polyphenols, so you definitely wanna get those. Also, nuts and seeds. particularly sesame seed and hemp seeds. These are really good because they contain ALA, and ALA is very good for antioxidants, so preventing that oxidation. Also, it's a form of soluble fiber when you're eating those type of seeds as well, and that's really good for the good bacteria in your gut as well. Okay, but these seeds are packed with iron, like sesame seeds packed with iron and calcium, which is hugely important, as I mentioned before, to the cardiovascular health. Also, ginger root. Ginger root is anti-inflammatory, so every morning I'm drinking ginger root tea. Okay, so that's my little routine. Also, rosemary. Rosemary is a herb that I incorporate in a lot of my food. So you put the medicine in the food, okay, with the rosemary. So I use that all the time. I try to use fresh, but if you can't use fresh, get the next thing that's best.